Dr. Henry, earlier this morning, Dr. Hillier in Ontario apologized for closing down and minimizing some vaccination clinics over the holidays. British Columbia also reduced hours at some vaccination clinics for COVID-19, and in some health authorities like Northern Health closed them entirely. Was it a mistake to do so, and are you concerned that we minimize the number of vaccinations that could have been done over the last week?
You know, I think we have done a lot of immunizations over the last week, and one of the things that we are learning is that this vaccine is fussy. Both of them. We're still practicing for receiving the Moderna vaccine, but it's not a simple thing to use the Pfizer vaccine, and so a lot of the time over this weekend was to build up the people, the training, and people to be able to safely do it and to take the Pfizer vaccine out of the point of arrival. And I know that every health authority was busy doing training, making sure we had the logistics in place, the complexity of pulling together the plans for the Moderna vaccine, particularly the vaccine that's going to a number of remote and isolated communities. And my hat goes off to the people who worked all weekend to try and make sure we have that ready to go and people trained and ready to go. So it is not like there was not a lot of activity happening this weekend, and absolutely we're committed to getting as much vaccine as we can into as many people safely and efficiently this week.
Follow-up, Richard?
Another thing that was mentioned in Ontario today from General Hillier was around the Moderna vaccine and going down to one dose instead of two and having Health Canada look at this. Is that something that you believe could be helpful in terms of immunizing more people, especially residents of long-term care?
Absolutely. I think for both Pfizer and the Moderna vaccine, they are currently licensed as a two-dose regimen. We have, from the very beginning, looked at the data that shows that both of these vaccines have very high vaccine effectiveness within 2 weeks of the first dose, upwards of 80% for both of these vaccines. And we don't know how long that immunity lasts, so we are absolutely asking Health Canada, the National Advisory Committee on Immunization, I know, and others around the world are looking at this too. So the people who, in the trials, who didn't get a second dose, how long did their immunity last? How good was it? There's lots of important things we need to look at. And we are looking at what we call vaccine efficacy here in BC as well. And our team with the Vaccine Evaluation Centre and BC CDC have already started that process so that we can monitor and make sure that if we're seeing breakthrough, for example, that we can record that. This is all part of understanding how new vaccines work. Right now, however, it is a two-dose program, and we made the decision after careful deliberation and discussion of the ethical framework that we have around how we're going to deliver vaccine, and we made the decision that for December and January, all of our doses of both Pfizer and Moderna will be going to protect people with their first dose, because we can do that and protect over almost twice as many people as if we started giving the second dose in the short time frame that is in the product monograph. And the National Advisory Committee on Immunization does allow for an extended schedule. There's a minimum period that you cannot give a second dose because it's not effective, but it's anywhere between, the recommended period is 21 to 28 days, but there's no outside limit to that. And we have looked at when we're expecting to get vaccine and how much vaccine we're getting, and our, on average, second dose will start to be given in February, which means for some people it would be about 35 days, so an extra week. And we have good data to support that immunity is still very protective for that short window. So that's what we've been doing, and that's what we've been working, how we're managing it here in British Columbia. We're not keeping doses in freezers from the December and January doses at all. That was the recommendation of the company, but we have determined that now that we have some confidence in the supply that's coming in the coming weeks, and this was all very much up in the air, even as late as last Wednesday and Thursday. But that is the decision we've made here in BC, and we're comfortable with that moving forward. for now. And I hope there will be some data that shows, it would be just wonderful if we could if people only needed a single dose. That would make our life so much easier.
Next question is from Denise Ryan, Vancouver Sun.
Hi, Dr. Bonnie Henry. Sorry, I was going to call you Dr. Bonnie. Congratulations on getting 12,000 vaccines in arms. That's fantastic. Yesterday, the BC Nurses Union criticized the rollout, stating they had knowledge of unnamed health administrators who had jumped the queue to receive the vaccine. Are you aware of any queue jumping? And if so, are you investigating this?
I think this is unfortunate. We are rolling this out. The people who have been designated, our focus, as we said from the very beginning, is on protecting those who are most at risk. And that is our elders and seniors in long-term care and workers in long-term care and key acute care workers, healthcare workers as well, particularly the ICU, COVID wards, emergency departments. And that is what the focus has been. Yes, there are some people who also have administrative roles who are in that group. For example, we have groups of public health and administrators who go in and manage outbreaks in long-term care homes, and they need to be protected so that when they go into those outbreak situations, they're not bringing the virus with them as well. So these are, we are confident that the vaccine is going to people who need it, and to healthcare workers and long-term care workers are our first priority. And I really encourage all of us to work together and make sure that we can support people to get this vaccine as quickly and as effectively as possible. And as we move into, hopefully, February, March, it's hopeful that we'll have both more of these vaccines, but also other vaccines that we can more broadly provide it to everybody, both in our healthcare system and in our communities.
Do you have a follow-up, Denise?
Yes, I do. Thank you, Dr. Henry. In terms of the vaccine rollout, between now and March, how many doses are we expecting in BC, and how many will be needed to cover those high-priority recipients in care homes, residential care, and frontline workers?
Yeah, so we presented some of that data last week, and most of it's available publicly with the general list of the numbers in each of those categories. So I would refer you to that in the presentation from the 23rd. But in general, we have about 30 to 40,000 people who work in long-term care, and another 30,000 residents in long-term care, and we have about 20 to 30,000 healthcare workers who fit into that first priority group, and that is our focus for January, as well as remote and isolated and at-risk First Nations communities. And we're working very closely with our First Nations Health Authority and First Nations leadership in BC to make sure that we can identify those communities and people at risk as most efficiently as possible. Then we expand into a number of other priority groups between February and March, and those numbers are all there. But we do, what we've done is looked at how we can expand given what we expect to receive. And I will say that it's all based on expectations right now. The only guarantees that we have so far are the vaccines that are arriving this week and next week. And we do not yet know for certain that we're going to get the quantities for the rest of January. But as we're getting into this cycle, and the cycle involves both the manufacturers, it involves the National Operations Centre in Ottawa, and our teams here on the ground. As we're getting used to using these, as people are getting trained up, and as we get confirmation of more vaccine coming, we'll be revising and adapting as we go. I think it's also really important to note that we need to respond to what's happening on the ground in each area of the province. And for example, this weekend the focus was on making sure we can try and protect people in long-term care that are having outbreaks, so that the outbreak doesn't expand rapidly and we can protect people as best as possible. So these types of decisions will be tweaked on a week-by-week basis, and depending on how we progress in the next few weeks. So this is again why it's so important that all of us do what we need to do right now to stop transmission, because it's transmission in our community that puts our elders, our seniors, and others in our community at risk. And now, as we're ramping up this immunization program and as more vaccine is coming, we need to hold our ground and keep the virus as low as possible.
Last question is from Eva Eugen, CBC.
Hi, Dr. Henry. If we want to reach the target you've set of those 400,000 immunizations by March 31st, we, by my calculations, we need to be immunizing approximately 4,300 people a day and twice that number to give them 2 doses. Can you clarify how many doses of vaccine we've received so far and how many daily vaccinations we're able to complete at this point, and what you hope that we'll have the capacity to do on a daily basis?
So, as you know, we've received small amounts to start with, and the amount that we expect to receive by the end of December is about 30,000 doses. So we have not received all of that yet. We've administered about half of what we've received so far. We administered all of the first week and most of last week's doses as well. But we are ramping up. I think it's easy to underestimate how fussy this vaccine is, and having been at both clinics, two of the clinics so far, it takes time to train immunizers about how to handle it safely so that the vaccine is still stable and works, how to reconstitute it. It is a very short period of time that you can immunize. So these are all things that we're learning, and we're taking the time to learn from each clinic about how to do them more effectively and more efficiently. So yes, we are ramping up, and we expect to be able to have we're aiming for 100% of the 30,000 doses that we will have received by the end of this week to be in people's arms by next week. We know there's going to be challenges with geography and being able to get it to some more remote areas, but the aim is to focus on getting it as effectively and quickly as possible into long-term care. So yes, it's going to take a Herculean effort, and we're ramping that up and training people as we go. And a lot of this past weekend was learning from the clinics that happen, making sure people are trained on how to use Moderna vaccine, and getting ready for increased clinics this coming week.
Eva, do you have a follow-up?
Yes, thank you. With this new variant, can you say whether, if we see more cases of this, whether that will delay phase 4 of BC's restart plan, meaning that, some of those events that people are hoping to start attending next summer will be delayed once again, and whether those will see restrictions extended or expanded because of this new variant? And can you get in French as well?
Sure. Well, as you know, we have orders that are in place until January 8th, and every day we are looking at, do we need to do more? Are these still making sense? Where are the areas that we're seeing transmission? So those are things that we are monitoring on an ongoing basis, and we will have more, of course, to say next week as we approach January 8th. It does make us more concerned when we have seen some of this variant here in BC, whether it is transmitted, whether it starts being transmitted widely, whether there's more cases out there, are things we are investigating. And absolutely, if we start to seeing spread more rapidly and more increased numbers of cases going up logarithmically, as we saw in October, and if we're seeing in other places around the world, then that would be very concerning, and we would need to take additional measures. As we're ramping up vaccine, of course, we're looking at how we can get to that level in our community where we stop transmissions because people are immune. And we are hopeful that that is going to be sometime next summer or into the fall at the latest. And that's what our aim is. So the restart plan, which was designed for last summer when we didn't have vaccine in the mix, will need to be rethought. But right now, we're really focusing on how do we get through this period now of our pandemic now. And right now in BC, we've leveled off and we've come down a little bit, but it is critical we keep doing what we're doing, and this variant reminds us that we cannot be complacent, and it's going to be so important last week, this week, next week, to take those measures to stop transmission, each and every one of us, every day.